We have a doctor shortage, and it's more severe than you might think. This is Healthy You. I'm your host, Sharon Stevens. In a minute, I'll tell you how the state is working on the problem. Missouri has 7 medical schools. The state ranks 9th in the nation for graduates, but the majority leave to work in other communities. How can we solve this problem? Well, Dr. Heidi Miller will tell us in just a minute.
We watched our friend be afraid and be fierce and be brave and have to do things and confront his government in these agencies and call out lies. It's not something he ever thought he'd have to do in his life. And for me, knowing that he passed away suddenly, I feel like this robbed him of more than just his life. It robbed him of peace.
Missouri Department of Health and Senior Services Chief Medical Officer Dr. Heidi Miller is here to talk about a new state program designed to retain more medical school graduates. Dr. Miller, welcome to Healthy You.
Thank you, Sharon.
Do people just not want to stay here?
Missouri is an amazing place to practice medicine and to raise a family, but we have a bottleneck in the physician workforce. Mm-hmm. We are really tremendous at treating physicians through medical school, but all medical school graduates require this residency training that can take anywhere from 3 to 7 years depending on your specialty. Mm-hmm. We don't have enough residency slots in Missouri. This is a national shortage, but we're seeing more of a shortage in Missouri.
We're on the high end.
We have a greater need, yes. And we also know that folks tend to stay where they trained. So medical school and residency is at least 7 years of training. And by the time you finish your training, you're in your mid-20s or even 30s. It's a time where you've already started a family or you want to start a family and you want to settle down. So we really need to increase training in the state of Missouri in order to retain physicians.
And that's expensive, isn't it?
Yes, so the cost of training a resident per year has been estimated to be between $100,000 to $200,000 per year. However, the states that have started to invest in physician training and residency training have found an economic benefit for this and a long-term health benefit. This is an evidence-based way to improve healthcare in the state. Indiana did a study, an economic study that indicated that every dollar invested in GME within the state reaps about $9 for return on investment.
Okay. Well, tell me about this new state program. How is that? What is it, first of all? And how is it going to change things so that, there's more money available to help more people?
I'm going to start with the second part of your question.
Mm-hmm.
So currently in the state of Missouri, we need 1,000 physicians.
Is that unusually high?
Well, actually, we have a nationwide shortage of physicians, over 50,000 physicians nationwide. In Missouri in particular, we need about 1,000 physicians as of today. That includes about 600 primary care doctors and 160 psychiatrists, plus others. So we have enormous need. And we need to hold on to these medical school graduates that are training in the state of Missouri. In order to do that, we have to expand these residency programs. Residency is called graduate medical education. And traditionally, residencies are funded by the federal government, but the federal government has some antiquated laws that capped hospitals and facilities that they cannot expand their programs and get additional federal funding. So a lot of hospitals and regions are struggling to get additional resident slots. And the federal government has been very slow to change their funding and increase those caps. Therefore, states have taken this into their own hands. Some states have been doing this for years or decades, but Missouri, and some states have done nothing along these lines. Missouri started a new program to support residency positions last year, and it's called the Missouri Graduate Medical Education Program.
And what does it do?
Yeah. So it started last year, funded at $2.3 million. And this enabled the Department of Health and Senior Services for the state of Missouri to administer a program via grants so that existing residency programs statewide that are no longer eligible for sustainable federal funding can expand their program by a couple of slots. And this new program enabled us to produce at least 9 new doctors every single year. And this is just the beginning. So we put out a grant application. We had more applicants than we had slots. And in total, we ended up funding 2 additional slots in psychiatry, 4 additional slots in family medicine, and 3 additional slots in internal medicine at facilities statewide.
Now, we're talking about 9 facilities or 7 facilities in Missouri, 7 hospitals.
So there are 7 medical schools in Missouri, but you bring up a good point, which is that medical schools can train residents, but so can additional facilities. So there are dozens of facilities across the state that have the capacity to train residents. It's not just isolated to a medical school location.
And how did the state come up with this funding? Where does this come from?
Governor Parson recognized the shortage of physicians, and the legislature provided bipartisan support, and Representative Kent Hayden proposed a bill to start expanding our residency programs. And so this $2.3 million program came from general revenue. In addition, one of the most innovative ways to fund Medicaid from the state's perspective is through our Medicaid programs. And our own Medicaid program, Missouri Health Net, also saw the physician shortage. And in 2022, they passed a state plan amendment to enable Medicaid funds to support hospitals that are teaching residents and fellows.
And you said this program at some point is going to help a number of specialty areas. So what are you talking about? Pulmonologists or something like that?
So we are aiming for the highest need specialties, and that includes mostly primary care. That specifically means internal medicine, family medicine, psychiatry, OB-GYN.
Okay.
And in the future, we may also consider addressing the shortage in rural general surgeons. We also need addiction specialists. So we are constantly monitoring the physician workforce to see what we need most. But at this point in Missouri, similar to the United States, we have a dearth of primary care doctors. And primary care doctors have the capacity to provide preventive care and management of chronic diseases so that patients don't need expensive emergency room visits, hospitalizations, and specialty visits.
Okay. And when did you first start noticing that this shortage was there or coming?
The shortage has existed for over a decade. And I started this position with the Department of Health and Senior Services last year, 2023, in January, and hit the ground running, realizing that this was an enormous issue that was actually fixable.
And when you say fixable, what are you looking at in terms of, do we have a deadline? We want to have this done in 10 years or something like that?
Oh, so this is a marathon, not a sprint. It takes quite a bit of effort to build graduate medical education, but it reaps great rewards. The state of Wisconsin has been a nice model for us. They started this nearly a decade ago, and at this point they have generated 100 new graduate medical education residency slots. And they did that arduously, program by program, but as a result, in Wisconsin, because of their efforts, they are generating 100 new doctors each year, and they are continuing to grow. We hope to do the same or even better, and we are delighted that the governor and the Missouri State Legislature put an additional amount of funds into this graduate medical education effort for this next fiscal year. And we are awaiting Governor Parsons' review of that budget, and he is expected to review that in the next month or two.
What took Missouri so long? I mean, compared with maybe places like Wisconsin or other places that got started earlier.
I credit Representative Hayden for having the foresight last year to start this. He is acutely aware of the physician shortage in his own area, in his own region. He understands the needs of his constituents and recognized that we needed this. Graduate medical education is really complicated. It is technically complicated. And as we've tried to learn about it, we've talked to hospital finance executives, and even they have confessed that this GME is needed so much, but it requires expert consultation. Mm-hmm. And what we've been missing for a long time in the state of Missouri is a statewide graduate medical education technical assistance center.
What does that mean?
Yeah, so we need an organization in the state that is monitoring our current programs, protecting them, helping them with technical assistance so that they don't close, and helping hospitals that have never done graduate medical education before, perhaps a rural hospital that wants to start a family medicine residency and build their physician workforce locally. When they need help with the technical complexities of starting GME, they need a statewide organization to support them. Some other states have this, and we are very eager to grow and to develop and grow a technical assistance center in Missouri with the funding coming this year. If we had had a technical assistance center years ago, we would have been even better equipped to grow residency programs. But now that we can really recruit that expertise in state, we will have the potential to grow programs further.
What was the reason that the federal government put these caps in place?
That goes way back in history, decades ago, and I don't know for sure, but I think there was a concern at that time of there being too many physicians. But that forecasting has not been accurate, and we're really suffering a physician shortage.
Mm-hmm. That just seems unbelievable. How could we have too many physicians?
Yeah. I also practice as a primary care doctor and have done primary care for 21 years. And patients have gotten sicker over the years. Adults have multiple chronic illnesses. Our children are suffering from obesity. Primary care is really challenging, really important, and our state and our nation really needs to invest in it. And we literally need more doctors doing it. We function as a team, but this state needs so much support to support all members of that team.
Mm-hmm. What about our neighboring state, Illinois? How do they compare?
I don't know their statistics specifically. I know that the residency shortage is a nationwide problem. And in fact, Missouri was invited to do a congressional briefing on this issue. There are a number of federal laws that are trying to change that federal funding cap for graduate medical education, and because they know that all states are facing this to some extent.
Mm-hmm. Okay. So what do you think the programs will look like, say, this time 2 years from now, 3 years from now?
So we are really excited that our legislature and our governor understand how to support our future physician workforce. If this additional funding passes in this next budget, that would enable us to develop an expert statewide technical assistance center for GME. GME stands for Graduate Medical Education. We're really eager for that. We want to grow new programs. But in the process of learning about this, we were really sad to learn that we've lost a couple of programs. As we were investigating different opportunities in different cities, especially rural areas, we learned that that Kirksville lost a surgery program, they lost an anesthesiology program, and it costs a lot of money and effort to start a new program. So we need to do everything we can to maintain and sustain our current programs. So in terms of future prospects, we are hopeful. We hope to have a technical assistance center. In addition, we want to develop brand new programs, and we will have a request for proposal for applicants and folks to develop new programs. We also want to create the opportunity for current thriving urban programs to create a major expansion of their programs into a rural facility that doesn't have graduate medical education. In addition, we want to give facilities an opportunity to maybe do a feasibility study to see if they have enough patients and enough volume to then apply to be a new program. And we're designing these new programs in a way that if Missouri gives you the startup cost and you're in a new facility, we want you to then tap into the federal sustainable funding, because new facilities that have not had graduate medical education before, they are not yet subject to the federal caps. So we're trying to be really cost effective with this. And then one more thing that we're trying to do. As we have partnered with residency programs across the state and really queried if they have an opportunity to expand their programs to a rural facility, we realized that not all of them have relationships with rural facilities. And some of their residents never rotate through a rural facility. And yet Missouri needs rural physicians and physicians wanting to serve in an underserved area. And we know through the data that the more time that a resident trains in an underserved or rural area, the more likely they are to commit their life to practicing in that region. And so we are looking at encouraging programs to develop rural rotations. Like if you're doing a 3-year curriculum through residency, then we really want to support at least a month or 2 of rotating through a rural hospital. And as a physician myself, practicing in an urban area, I have to tip my hat to our rural physicians who are doing everything on their own. They don't have a specialty for every body part within 5 minutes access of them. They really are doing a tremendous job with a broad scope and breadth of work, and our residents can learn so much from our rural physicians.
Let's bring it down to a practical level. What is this going to mean for Jeannie and Jim and their family of 4 children?
Yeah, so I can ask you a rhetorical question and that of your listeners and viewers. Do you have a primary care doctor? If so, how long did you have to wait to get in? Most people will attest, myself included, that it takes a while to find a new primary care doctor because we have a shortage. And so if we are able to populate the state with more physicians, there will be greater access to care. We are targeting our funding and program toward underserved populations so that the result will be more equitable care, better access to care, higher quality of care, closing health disparities, and trying to get the health status of Missourians being ranked around 40 to a higher ranking.
Thank you so much, Dr. Miller. I appreciate you sharing that information. And yes, I'm sure all of us have been through that, you know, where you make an appointment when you can get that appointment. And, you know, let's say you have to cancel another 4 or 5 months before you can get in to see your doctor. So I think a lot of us understand exactly what you're saying. Thank you so much.
Thank you, Chair.
Healthcare is critical to our overall well-being. We need more doctors, and this program is a positive step to accomplishing that goal. I'm your host, Sharon Stevens. Thank you for watching.